What if the very position you have been sleeping in your entire life has been quietly working against your heart every single night? Tonight, before you close your eyes, there is one thing you need to know. Something that takes no money, no prescription, and no special equipment to change. Something that could reduce your risk of stroke and life-threatening blood clots while you sleep, starting tonight. And yet, the overwhelming majority of adults over 60 have never once been told about it. Silent circulation damage does not announce itself. It builds every night that your body spends in the wrong position. Blood moves more slowly through your deep veins. Pressure accumulates in vessels that are already working harder than they did 20 years ago. And the conditions for dangerous clots quietly improve. It is not dramatic. It is not painful. It is gradual. And that is precisely what makes it so dangerous. My name is Dr. Lauren Hayes. I have spent over 2 decades at the intersection of cardiovascular medicine and sleep, studying what the heart, the veins, and the brain are doing during the hours your doctor never asks about. And what I am about to share with you is something I wish I had told every patient I have ever seen 2 decades before they needed me. There is one sleep position that actively works against the formation of blood clots in your veins while you sleep. One position that relieves measurable strain from your heart through every single one of those 8 hours. And almost nobody is sleeping in it. Not because it is complicated, not because it demands anything you do not already have, but because the person who knows the research, the cardiologist, the vascular specialist, the physician who sees you for 15 minutes once a year, has never made it part of the conversation. That conversation starts right now. The answer itself is simple enough to say in one sentence, but a sentence without the science behind it is just a suggestion. And suggestions do not change behavior. Understanding does. So stay with me, because by the time this video ends, you will not just know what to do. You will know exactly why it works. And that knowledge is what will make you actually do it tonight. Before I tell you the position, you need to understand something that almost no one in medicine takes the time to explain. Sleep is not passive. Not for your heart, not for your blood, not for your brain. While you are lying down with your eyes closed, your cardiovascular system is doing some of its most critical work of the entire day. Your blood pressure is attempting to drop into recovery mode. Your lymphatic system is clearing toxic proteins from your brain. Your venous circulation is returning blood from your legs, your abdomen, your pelvis, back to your heart through a network of vessels that, after 60, are working harder than they used to. And here is what changes everything. The direction your body faces during those 8 hours determines whether that work happens efficiently or under strain. For most of medical history, sleep position was treated as a comfort issue, not a cardiac issue, not a circulatory issue. Doctors asked about your diet, your exercise, your medications, your stress levels. Nobody asked which way you were facing when you slept. That is changing. Over the last 2 decades, a body of research has emerged that makes one thing unmistakably clear. Your sleep position is a cardiovascular variable, one your body experiences for a third of your entire life. And after 60, when the margins are smaller and the stakes are higher, it matters more than most people will ever be told. Let me introduce you to a patient I will call Margaret. Margaret was 71 years old, retired nurse, which meant she was more medically informed than most of my patients. She ate carefully, walked daily, took her blood pressure medication without fail, and had regular cardiac monitoring. She came to me not because of a crisis, but because of a pattern she could not explain. Her morning blood pressure readings were consistently higher than her evening readings. Her cardiologist had adjusted her medication twice. Nothing shifted it meaningfully. She also mentioned, almost as an afterthought, that she had been waking up with her right arm numb for the past 2 years. She had assumed it was a circulation issue from the way she positioned her arm. She had never connected it to her heart. When I asked her what position she slept in, she said immediately, "On my right side. Always have been." We will come back to Margaret, because what happened in the 6 months after that conversation is the reason I make videos like this one. Here is the position, the one that works for your heart, your veins, and your brain simultaneously. The left side. That is the answer. Sleep on your left side. And now, let me show you exactly why. Because without the mechanism, it sounds too simple to be real. With it, you will never sleep on your right side the same way again. Reason 1, your heart is not centered. This surprises almost every patient I explain it to. Your heart is not sitting in the middle of your chest. It is offset, positioned significantly to the left. Roughly 2/3 of the heart's total mass sits on the left side of your body. That is just anatomy. That is how you were built. Now, consider what happens when you sleep on your left side. Gravity works with your heart. The natural angle of your cardiac position is supported rather than resisted. The heart does not have to work as hard to push blood forward into circulation. Think of carrying the same weight downhill versus uphill. Same load, same distance. Dramatically less effort going downhill. Your heart beats approximately 100,000 times every single day. Over a lifetime, that is a number too large to comprehend meaningfully. But what it means practically is this: anything that reduces the workload of each individual beat, even slightly, accumulates into something profoundly significant over years and decades. After 60, when the heart muscle may already carry some degree of stiffness or reduced pumping efficiency, every fraction of mechanical advantage counts. Left side sleeping gives the heart that advantage. Every night, for 8 hours, for free. Reason 2, the inferior vena cava. This is the piece of anatomy your cardiologist has almost certainly never discussed with you, and it may be the most important structure in this entire conversation. The inferior vena cava is the largest vein in the human body. Its sole function is to carry deoxygenated blood from the lower half of your body, your legs, your abdomen, your pelvis, back up to the right side of the heart, where it can be pumped to the lungs for reoxygenation. Here is the critical detail. This vein runs along the right side of your spine. When you sleep on your right side, the weight of your organs, your liver, which is the heaviest organ in your abdominal cavity, along with your stomach and intestines, presses down on that vein. Not a complete compression, not a dramatic blockage, but a partial, sustained, gentle pressure that slows the flow of blood returning to your heart throughout the night. And slower return means your heart has to work harder to compensate for the reduced incoming blood volume, night after night, year after year. The accumulated effect on a heart that is already working against stiffer vessels and reduced elasticity is not trivial. When you sleep on your left side, that compression is removed entirely. The inferior vena cava runs freely. Blood returns to the heart without restriction. Venous return, The efficiency with which blood flows back to the heart improves measurably. And for adults over 60, whose veins have lost some of their youthful elasticity and whose venous valves are less effective than they were at 40, removing that obstacle is genuinely meaningful. Reason 3. Blood clots form in still blood. Thrombosis, the formation of blood clots inside the veins, is one of the most dangerous and most silent cardiovascular threats that exists. Deep vein thrombosis, clots forming in the deep veins of the legs and pelvis, kills by traveling to the lungs as a pulmonary embolism or by contributing to stroke when clot material enters the arterial circulation. Here is what most people do not know. Blood clots do not only form on long flights or after surgery. They form wherever blood moves too slowly. The medical term for slow or stagnant blood flow is venous stasis. And venous stasis happens every single night in people who sleep in positions that compress their circulation. When you sleep on your back or your right side, blood can pool in the deep veins of the legs and pelvis over those 7 or 8 hours. Over 60, circulation naturally slows. Vein walls lose elasticity. Blood viscosity changes, particularly in people on certain medications or in people who are even mildly dehydrated. The conditions for clot formation are present every night. The question is whether your sleep position is making that risk better or worse. Left side sleeping actively encourages venous circulation through the deep veins. The inferior vena cava flows without compression. Blood keeps moving. And moving blood is safe blood. Stagnant blood is where the danger begins. Here is a question I ask every patient I see for a follow-up after a DVT event. What position do you sleep in? The answer, almost without exception, is right side or back. That pattern does not surprise me anymore, but it should have been caught earlier. It should have been discussed earlier. That is the gap this video is trying to close. If you have made it this far, you are clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Before we go further, what position have you been sleeping in for most of your adult life? Write it in the comments right now. Left side, right side, back, or stomach. I read every one of them, and I want to know how many of you have ever had a doctor ask you that question during a cardiac consultation. Reason 4, the glymphatic system and stroke prevention. This one surprised me when I first encountered the research, and I have been reading cardiovascular literature for over 20 years. Your brain has its own dedicated waste removal system. It operates almost exclusively during sleep. It is called the glymphatic system, named for the glial cells that form the channels through which cerebrospinal fluid flows, washing metabolic waste products out of the brain tissue that accumulate during a full day of activity. Among the substances this system clears is amyloid beta, a protein strongly associated with Alzheimer's disease and vascular dementia. Another is tau protein. These are the same materials researchers consistently find accumulated in the brain tissue of patients with significant cognitive decline and cerebrovascular disease. Here is what the research shows. The glymphatic system works most efficiently when you sleep on your side. And between the two sides, left side sleeping appears to optimize the drainage pathways further, based on the architecture of the brain's internal drainage anatomy. Why does this matter for your heart and your stroke risk specifically? Because vascular inflammation in the brain, driven in part by the accumulation of these waste proteins, directly increases the risk of small vessel disease, microstrokes, and eventually, major stroke events. The brain and the cardiovascular system are not two separate departments. They share the same blood supply. What damages one damages the other. Protecting the brain's overnight cleaning system is protecting your cardiovascular system simultaneously. Reason 5. Nocturnal blood pressure dipping. In a healthy cardiovascular system, blood pressure drops naturally during sleep, typically between 10 and 20% below daytime levels. Cardiologists call this nocturnal dipping. It is not incidental. It is one of the body's primary overnight repair mechanisms. The arteries, the kidneys, the heart itself all benefit from that nightly window of reduced pressure. People whose blood pressure does not dip at night, who cardiologists call non-dippers, have significantly higher rates of heart attack, stroke, and kidney damage than people who dip consistently. The older you are, the more consequential that distinction becomes. Sleep. Position influences whether nocturnal dipping occurs. When circulation is compromised during sleep, when the inferior vena cava is partially compressed, when venous return is reduced, when the body's stress response remains partially activated because the cardiovascular system is working harder than it should, cortisol and adrenaline remain slightly elevated throughout the night. And elevated stress hormones are one of the primary reasons blood pressure fails to dip. Left-side sleeping supports better venous return. It also reduces positional sleep apnea. Episodes of airway obstruction that cause sudden overnight blood pressure surges, that directly prevent nocturnal dipping. Fewer apnea events mean fewer pressure surges. More consistent dipping means a heart that wakes up genuinely rested, rather than one that has been working against elevated pressure for 8 consecutive hours. I promised I would come back to Margaret. After that consultation, Margaret made one change. She switched to sleeping on her left side. She placed a firm pillow behind her back to prevent rolling over during the night, a simple and effective technique. She placed a second pillow between her knees to keep her spine aligned and her hip comfortable. 3 months later, she came back for a follow-up. Her morning blood pressure readings, the ones that had puzzled her cardiologist for 2 years, had dropped meaningfully. Not dramatically, but consistently. The elevation that had prompted 2 medication adjustments had partially resolved on its own, without any change to her prescription. The arm numbness she had attributed to poor sleeping posture was completely gone. She was sleeping more deeply. Her husband told her she was snoring less. She said something to me that I have thought about many times since. She said, "I spent 30 years as a nurse. I gave patients advice about their diet, their medications, their exercise. Not once did anyone ever tell me about this." That is the gap. It is not a gap of medical knowledge. The research exists. The mechanism is well understood. The gap is in the conversation between what the research shows and what actually gets said to patients before they go home and go to bed. You are having that conversation now. Let me bring this all together. 5 things I want you to carry away from this video and act on tonight. 1. Your heart sits to the left of center. Left side sleeping allows gravity to assist its pumping action, rather than resist it. 8 hours every night, that accumulates. 2. The inferior vena cava runs along the right side of your spine. Sleeping on your right side compresses it. Left side sleeping removes that compression entirely and supports full venous return. 3. Blood clots form in stagnant blood. Left side sleeping keeps circulation moving through the deep veins of your legs and pelvis. For adults over 60, that matters more than most people realize. 4. Your brain's glymphatic cleaning system works best when you sleep on your side. Clearing amyloid beta and tau protein overnight reduces vascular brain inflammation, and that directly reduces stroke risk over time. 5. Left side sleeping supports nocturnal blood pressure dipping, fewer apnea events, lower overnight cortisol, and more consistent overnight arterial repair. Now, how do you make the switch if you have slept on your right side or your back your entire life? Start tonight with one firm pillow placed behind your back. It does not need to be large, just firm enough to prevent rolling over without you realizing it during deep sleep. Place a second pillow between your knees. This keeps your hips stacked, your spine neutral, and removes any joint discomfort that makes side sleeping feel uncomfortable. Give your body 1 week. The adjustment period is shorter than most people expect. After 2 weeks, most people stop thinking about it. The body finds its new pattern quickly. You are simply guiding it toward a better one. Here is what I am asking you to do tonight. Not next week, tonight. Before you get into bed, place a pillow behind your back and one between your knees. That is the entire action. The rest happens while you sleep. What position have you been sleeping in? And has any doctor ever discussed this with you? Tell me in the comments. I read every one. And if this video gave you something you needed, please share it with your spouse, with a sibling, with a friend who is managing blood pressure, or recovering from a cardiac event. This information should not be hard to find. Let us make sure it reaches the people who need it before they need it most. If you have not subscribed yet, please do. Every week, I bring you honest, research-grounded information about what your body needs after 60. The information I wish every patient had, long before they ended up in front of me. Take care of your heart. It has been working for you every single minute of every single day for decades, without asking for anything in return. Tonight, give it a little help. Turn to your left. Let it rest a little easier. Disclaimer: everything shared in this video is general medical information based on published research and clinical experience. It is not a substitute for your personal medical care. If you are currently managing a cardiac condition, sleep apnea, or have been advised by your doctor to sleep in a specific position for medical reasons, please follow your doctor's guidance and bring this information to your next appointment. Your individual situation is unique. This is education, not a prescription.